this is Alex from the Pear Shape team. So today you have a video with just me, and this video, as you've probably seen from the title, is my acne journey and all the things that I have done to get to the point that I'm at now. It has taken quite a few years. I have tried no end of products, but there is one thing which has completely changed my skin for the better, and I will tell you as we go through this video. So to go into a bit of history about my acne journey, I never had problems with acne really as a teenager. You know, I'm sure the occasional spot here or there, but it was never really a big problem for me. Then I got to about mid-20s, gradually over the course of a year or two, my skin just got worse and worse and worse. And it started out with a few spots. Then it became general redness all over my face. Very, very big cystic acne, very painful spots, and they just wouldn't go. They would be there around for weeks and weeks, and they would just take forever to clear up. Certainly at the start my skin was more acne, more spots, but actually as it progressed it became into more of an acne rosacea. So I had overall redness to my skin, which wasn't necessarily specific spots, it was just very severe red flushed areas. Obviously cheek, nose and chin are the main areas that tends to occur on. It can really affect you and your confidence and your as a person. You'll see some of these pictures. Slightly embarrassed to share, but I think it's good to see the before and after. Obviously as they started to get worse and worse, there's so many things that I tried to get rid of it or improve the situation. A lot of them didn't work. If you're someone who's going through this journey, you know it can become quite all-encompassing. You can spend a lot of time, a lot of money on trying all these different things. So I wanted to come on here and tell you about what I think truly, for me, has been a game changer. So one of the first things that I tried is, and probably most of people have done the same thing, is going into your local drugstore or local pharmacy and picking up an over-the-counter spot treatment cream. I tried a few different ones. There's a number of brands in the UK here that I tried. Some would work for a bit, but I tend to find that they would lose their effectiveness. So these over-the-counter spot treatments did help a tiny bit for a short period of time, but it wasn't fixing the real problem that was happening. So after several months, maybe close to a year of trying to manage the acne myself, I finally went to the doctor, to my local GP, and I think perhaps local GPs are maybe not well versed in dermatological issues. So at the time they prescribed me a 6-month course of antibiotics. Now, again, something I didn't really want to do at the time, like being on a long course of antibiotics wasn't my preference, but I thought, well, perhaps if it helps, of course I'll try it. And it did help, especially towards the last few months of being on that course of treatment. My skin had started to really clear up. The problem was, as soon as I stopped my course of treatment, it came back, and it came back worse than it was before. And it wasn't sustainable for me to stay on that course of antibiotics. So while that did help a little bit, it really wasn't the solution for me. After finishing my course of antibiotics, I went back to my GP and they actually referred me to a dermatologist. Now the dermatologist that I went to go and see, I guess they have a set course of treatment that they would usually try, and the first thing that they suggested to me was actually getting onto a contraceptive pill that could help potentially balance my hormones, because they thought at the time a lot of it was hormonal because there was a lot of spots on the chin area. So that was something else that we tried, and I did continue on that contraceptive pill for a number of years. Again, I think there was perhaps some mild improvement as a consequence of that, but it wasn't fixing the problem, and there was still a lot of redness, very sore, red, painful cheeks and nose, which it just didn't address. On my second visit to see the dermatologist, they suggested that in addition to the contraceptive pill which I was on, they suggested a topical cream they could prescribe, which they thought would help it. And the reason why they prescribed this is because it was something that could address both the acne and also the rosacea. So I was prescribed azelaic acid, which is relatively common again for treating acne and rosacea. I did again find some mild success with it, but there were some side effects. It really dried out my skin. My skin would flake off. It would be again quite painful, and it was something that again you had to sort of continue to use every night forever if it was going to continue to work. And I still would find that I would still get spots, I would still have problems. And of course by this point I'm getting good at using makeup to try and cover it up, but it's a vicious cycle, and it wasn't really fixing again the root cause of the problem. So on my third and final visit to the dermatologist, I think at this point there was sort of a feeling of like we've tried all the things that we can, and the last course of action was to go onto a drug called accutane. I believe from my research is that it is a drug that does have a lot of success in clearing up acne in a lot of cases, but when doing a bit of research on the drug, there are a lot of side effects. So it does cause birth defects. You're not allowed to get pregnant during that time. Not that I was planning on doing it at the time. There's also links with mental health issues. It can cause depression. It's just a drug that, to me, there was a lot of side effects, which really made me question as to whether this was the course of action that I should go down. At this time, bear in mind, I mean, years have passed. I've been dealing with this for 3-4 years. And you sort of feel like you're a bit at the end of the road and you're getting a bit desperate and wanting to try something that will work. But this is where the story kind of gets interesting. So, after doing all my research on Accutane, it was something that I was a little bit reluctant or a little bit hesitant to do. And at that time, Elliot actually approached me with another possible solution. We had gotten quite into watching Instagram or YouTube videos of, there's a lady in the US called Dr. Pimple Popper, Sandra Lee, and she's got quite a following now as being famous as a dermatologist who pops massive pimples. While it is completely gross, there's something morbidly fascinating about watching these videos. And Elliot actually came to me and said, well, wait a minute, she's just released a line of skincare. And I felt like I had tried every possible range of skincare. I tried all the spot creams, and you see all these things online and you just assume that they don't work. You just think it's not going to work for you. But we thought before we try this final course of Accutane, it would be worth giving it a go. Nothing to lose from doing that. We're very fortunate, we make quite a few trips to the US. We picked up a set of skincare cream and started trying it. So I should make it very clear that obviously this video is not sponsored. I'm just telling you about what worked for me. Within probably 2 or 3 weeks, the improvement in my skin was significant. It was incredible. We just couldn't believe it. And after just a couple of months, the comments I would get even from people at work or friends or family, they could not believe the difference in my skin was completely remarkable. And all from something which, I thought would never happen. So the Sandra Lee acne system, or as we call it, the Dr. Pimple Popper cream, is made up of 3 or 4 products that you can choose depending on if you have normal skin or sensitive skin. It's a fairly simple system. It's a cleanser, it's a spot treatment, and it's a moisturizer. Honestly, it clears up spots if and when they do occur so quickly. But the biggest thing is it mostly just prevents them even occurring, which for me is such a big thing. And especially as when I used to get spots, I used to scar quite heavily. So obviously just preventing them from occurring in the first place really is the solution. And even now, after a year of continuing to use it, I still use it every day. It doesn't dry my skin out. There's really no side effects or downside to continuing to use the cream. It's not too harsh or anything like that on my skin, which can be a bit sensitive sometimes. I think if you're someone who's going through an acne journey, I think it's important to not get down. It can take a really long time to find the thing that works for you. It might be this Sandra Lee acne system, it might be something else, but before you go down to a drastic treatment route, I would really say just try and stay positive, focus on. You will get there eventually, and it can get better, I promise you. So thank you so much for watching. I hope that this video has helped you if you're someone who's also going through an acne journey or an acne struggle at the moment. But do remember there is light at the end of the tunnel. It just takes some time. Don't forget to like, share and subscribe this video, and most importantly, if you have any other tips or things that have helped you with your skin, do leave them below. I'd love to hear them. Thanks, bye.